Dr. Simi is a luxury health, wellness, and leadership brand pioneered by me, Dr. Simisola Alabi. I have a clinical and leadership career spanning over 20 years, and this enables me to bring you actionable information, products, and services to enable you live your lives to the fullest. My career in health has seen me work across various specialties, from children's health to urgent care to family medicine. I have a keen interest in women's health. My career in leadership has seen me work across organizations and deliver results from time to time. The whole aim is to help you live your lives to the fullest, as I said. And I want you to make sure you come back to our channel if you're ready to take action right now, to come back to this channel over and over again, and make sure that you invite your friends to connect with us on social media as well. I've had a long career in medicine, but I know that it is not the doctor that heals. I know that it's a combination of every aspect of your life, and usually even a higher power involved as well. So I want you coming back and learning more from us and making sure that you come into our offices, and we can even come to you as well to make sure that you live that life to the fullest. In this new era and with the COVID pandemic, no one else is responsible for your health apart from you. So there are 5 equipments that you should have at home to make sure that you're always at your best and optimum health. The first thing you should have is a blood pressure monitor. You know that so many Africans particularly die of high blood pressure. They suddenly have a stroke or suddenly have a cardiac arrest. That's what we call a heart attack. And usually people will say, we don't know what happened. Many times, their blood pressure is very high and they're not even aware at all because they have no symptoms. So take notes, go and buy yourself a blood pressure monitor. They are not expensive. You can order them online and know what your blood pressure is, and also know what a normal blood pressure is. A normal blood pressure should be reading 120/80 or below, nothing more. So the first equipment you should have is a blood pressure monitor. The second equipment you should have is a SATS monitor. It's a small little equipment that you put on the tip of your finger, and it tells you how much oxygen you are getting. It is a lifesaver because you know that if it's below a certain level, then you need to be going to the hospital or calling for help. And if it is higher than that, then you don't need to worry. It's not just because of COVID. For people who are asthmatic, it's a very big life-saving equipment, because they know that if their oxygen levels go below a certain point, then there is crisis. So that is your second equipment. So the third equipment you should have is your blood sugar monitor. This is very important. Diabetes is also a silent killer, and many people are walking around with diabetes and are unaware, many times only finding out when they now have kidney failure or other types of severe disease. The blood sugar monitor is cheap, it's easy to use, and you can actually share it across more than one household, as far as you're keeping the needles clean, making sure you're not reusing needles, and making sure that you're keeping the equipment safe. It will tell you what your blood sugar level is, and you know that if your blood sugar level is high, then you need to be speaking to your healthcare provider. Many times, a simple lifestyle change will make your blood sugar better, or medication. It's very easy to look after diabetes if you catch it early. So buy that blood sugar monitor. Number 4 equipment is your first aid kit. Now, when you have a little injury at home or something happens at home, you should be able to bring out your first aid kit and dress the wound. You should be able to perform little operations at home without having to go in. If you have a needle stuck in your foot or in your leg or in your hand, or your children as well, the first aid kit is crucial. And then lastly, this one is very interesting. When people are in pain or they have a fever and they talk to a nurse or a doctor and they ask you, have you taken anything for it? People will say, no, I haven't. You should have, because you should have a little box at home that has these emergency medicines. And what emergency medicines should you have in this box? Painkillers. So paracetamol is an essential that should go in there. Antihistamines. What are antihistamines? They are for allergies. So if you get a rash or you get something bite you and you start reacting to it. So simple antihistamines. You should have things that can help you have more water in your body if you have something like gastroenteritis where you're going to the toilet, you've eaten something bad, you should have something that will help rehydrate you. And little creams and potions to help you with, spots on your body. Just simple emergency medication at home. These 5 things will help you take care of yourself. Healthcare and wellness is no longer the way it was before. Things have changed. Now you are in the driving seat of your own health. If you want more information or if you want to know where to get all this equipment, if you connect with us, we'll be able to connect you to the right suppliers and be able to supply you with this equipment should you need them. I hope you've learned something, and I hope you go out and buy this 5. Thank you so much for joining me on today's episode of Dr. Simi. Now, we will be back again next time. Remember to subscribe to our channel and to connect with us on all our social media handles. We are at Dr. Simi on every platform. Check out our website. It is www.dr-simi.com. And join us next time on the next episode of Dr. Simi.